Hello, my name is Brian, and my EMS topic I'm going to discuss or talk about is a triangle bandage. A triangle bandage is it's a simple but effective piece of first aid equipment. A bandage, first of all, is a strip of cloth or other material used to bind or support a wound, sore, or sprain. A triangle bandage is used in most cases to support the patient's arm after injuring it, or a shoulder to help support, to keep it more comfortable. After a patient receives a splint, let's say for a possible broken or sprained arm, they should expect to get some sort of sling to help support it. Sling is something, or a longer-term splint. Longer-term sling is something we're going to get, you're going to see at the doctor's office or maybe even a hospital. But in the meantime, out in the field, what we're going to do is give them a triangle bandage type sling, where we carry on the trucks. Usually come in a bag like this, with this type of material. And, also, as I mentioned before, when a patient injures their arm, let's say broken a clavicle or something like that, it's going to be a lot of bearing weight on their shoulder, and in order to help support that and prevent it from either further injuring itself and also to keep it a little bit more comfortable, it's a good idea to give them a sling. Our slings that we see on the trucks, like this, they're going to be put together as such. I'll try to back up here so you can see. What you're going to do is you're going to unfold it, and like we said, it's a triangle, so it comes out like such. You're going to grab that largest angle, that 90-degree angle, and you're just going to make yourself an overhand knot. After you've done that, that's going to create a little pocket where it's actually going to be put on the patient's elbow. Now obviously it's easier when you have two people doing this, but basically what you're going to do is you're going to take one corner of it, stretch it across the person's chest, keeping that elbow in the pocket, and on the inside you can bring it up that same side, and then stretch this across the back and tie the two behind the neck here. And a good idea also is, when you tie that knot behind the person's neck, is to give a little support back there, a little bit, some gauze or something like that. If the person's going to be in it for a long time, it just makes it a little bit more comfortable, and try not to tie it on the person's upper part of their spine there. That's all I'm going to say about a triangle bandage. Also, just when you're done there, you want to kind of dress it up just to make it a little bit more comfortable. You can tighten it, loosen it as need be to make it more comfortable for the patient as well. It's all about triangle bandages.